Yeah, a wonderful good afternoon time to you all, wherever you're watching us from across the world. This is welcoming you to the program Shagalinku on the station here. My name is Ambassador Emmanuel Gabari, and this is thanking you all for joining us. Today we'll be talking health. We'll be looking at financing health and what we can do to also make our leaders accountable, what we can do as citizens to make sure that and from the federal, the states, and all that, that there is enough attention paid to health. COVID-19 has also shown the world and a lot of countries that they need to do more of their preparedness when it comes to not just for pandemic. And I have two wonderful ladies in the house, and they'll be telling us more about all this and talking more about how we can use social accountability to make sure that we look more into our health system and find ways to better the lot. We'll also delve into maternal health, what women can also do to safeguard themselves and their unborn child, because the COVID-19 pandemic also brought about a lot of issues as regards to maternal health. A lot of women were also scared of going to the hospital because of fear of also being exposed to COVID-19. Anyway, I have my guests here and I'll bring them on to introduce themselves. I have Esther Agbon and I have Chinasa um, Imo, and I like them to start off. Okay, let's start off with Esther Agbon. Welcome to the show. You are a first timer here, so I would like to start with you. Let's know your name, what you do, where you are resident, and then we'll take it up from there.
Thank you, Ambassador. And I'll say hello to all the viewers all over the world from wherever you're watching. My name is Esther Agbon. I'm the Senior Health Financing Advisor working on Evidence for Action projects, which is an options project, Abuja, Nigeria.
Okay, thank you very much. I know we'll still talk more when we come back as the program progresses. Let me welcome our regular here. She's been on this show like 4 or 5 times. Okay, so Chinasa, would like you to fully introduce yourself and let's talk more.
I think I should become a stakeholder in Shagalinku program so that every time I want to come on board, I just wave my hand and I'm there. So hi everyone, good afternoon. I hope you are enjoying your day. My name is Chinasa Imo. I am the Niger State advisor for the Evidence for Action Mama Year program, which is owned by Options Consultancy. Thank you.
Thank you very much, Chinasa. And I like to start with Esther Agbon. A whole lot have been on, especially when the flyers came out. A lot of people were like, what is social accountability? What is um, a health system doing with social accountability? People know the health side, people know of maternal mortality, people know COVID-19 has exposed a whole lot. But what drew their attention was that social accountability part, because a lot of times citizens don't also know that they have a stake in governance. They also don't know their voices are strong enough to make a change. So I'll start with you, Esther. What do you think, in your words, is social accountability, and how can we even use it in terms of health care?
Yeah, social accountability. What today we now know as, citizens getting involved in, ensuring that things work out properly. So be it on the government side or in terms of, businesses, companies, individuals, you can all have accountability. But accountability simply means, let's start from what it actually means. It actually means that someone is held accountable or someone is held responsible for a task that is being given to that person. So it can be an individual, it can be a government, it can be or a company, an organization. So you have goals, you have targets as an organization, or for on the part of the government, you have commitments. Like for now, we have the 2021 budget in place, or we are running the 2020 budget. So you have made commitments ensuring that you provide for healthcare, transportation, education, and what have you. So accountability simply means that you are responsible for delivering that. So in your responsibility, you are also answerable. Okay, maybe upward or downward. So there's an upward accountability to those who gave you that task to be done, and then there's a downward accountability to those whom you are delivering whatever services you're delivering, which of course in local parlance, or let's say the NGO, non-governmental parlance, we like to say the beneficiaries of those services. So whoever you are giving those services to, also there's a downward accountability. Like we have agreed that accountability is being answerable, it means that at the end of whatever you're doing, you are reporting. So moving now to social accountability, we need to understand that social accountability in terms of governance, you will find out that yes, whoever is implementing, for instance, the Ministry of Health, it starts with implementing the health budget and has programs and projects that it's supposed to implement. Now, it's answerable to the government of the state, or at the federal level, the president is answerable on how it has implemented that budget. But the Ministry of Health is also answerable to the people who are benefiting from those projects. Now, where social accountability comes in is when the people come together, to also demand reports, demand what you have done and how well you have done it. Now, bringing people coming together, people of like mind, civil society, media, professional bodies, all of them coming together to ask, because they are not tasked with that responsibility right now, but they are also interested in knowing that those services or those sort of responsibilities that was given to that ministry or agency is done properly. So people outside of government come together to work and ask, as a group, that how have you done this? Have you done this well? Or are there gaps? What are how the ways that we can make you do it much more better, that it will serve us who are the beneficiaries of these services? So social accountability is simply when everyone, mainly beneficiaries, NGOs, non-professional bodies, all come together to demand answers, on how well. It could be the budget, it could be a program on maternal health, it could be whatever task it is, to demand answers. How well has it gone and how well is it doing? If you are doing right, and they give you a pat on the back, simply
Okay,
put.
thank you very much, Esther. Yeah. So, in case you just joined us, the program is Shagalinku TV. This is the Tuesday's edition, and we're looking at social accountability. We're looking at health financing. We're looking at how citizens can also lend their voice and be part of the process. Because it's not just enough for government to release budgets and do all the paparazzi there. Citizens must also begin to follow it and follow the money and make sure that what has been budgeted for is also down on the grassroots and citizens can actually feel it. And the comment section is there. You can drop your comments for either questions or comments or opinions, and our guests are here to answer them. I have Esther and I have Chinasa. I'll be coming now to Chinasa to ask her one question concerning this whole thing. I like the part where Esther talked about social accountability being also a two-way thing. So yes, the government is bringing theirs, and social accountability also requires the citizens to also know, are these projects being implemented? Are they having the value that it's supposed to be? So let me even bring this, Chinasa. I know option is heavily into maternal health. So when we marry now this social accountability into this issue, would you also say that a lot of women are also beginning to, because the truth is, if these women who visit hospitals, who take, who access maternal health care, are not also being able to talk about the deplorable conditions of where they go to access these facilities, we may just be overlooking a whole lot of things. So how do we also marry social responsibility, accountability, like Esther has said, in terms of your work on the field for maternal health for women? Yeah, you have to unmute your mic, Chinasa. Okay, fine.
Sorry, I'm learning to do this. So like what I was saying is that I'm going to demonstrate this with a practical approach that we use here at E4A. So specifically here in Niger State, what we've tried to do is to set up an accountability mechanism that involves the government officials, that's the people from the Ministry of Health, the coordinating ministry, that's the planning and economic ministry, Ministry of Women Affairs, Ministry of Finance. And then we also brought CSOs, that's the civil society organizations. Then we have professional bodies like Nurses Association, Doctors Association, and then the media, our mouthpiece. And then we have representatives of the communities. Now, everybody mustn't carry what's it called, a citizen's card to say this is how well government is faring, but they talk through a particular channel, and those channels form that coalition. And what they do is to aggregate from the grassroots the women receiving these services in primary healthcare centers, at the secondary healthcare centers. What is their experience like? So they aggregate this at that platform, they bring in those feedbacks. It can come as an organized feedback, like we have citizen scorecards, or it can come from a survey where World Development Health leaders do like a mini survey to aggregate, that information and then sieve it to the state. So what are we doing? We want to look at what the government have said they are going to do in their budgets. Let's even start from the budget. So what did they commit to do in the budget vis-a-vis what the citizens are receiving? Because at the end of the day, these two things have to marry. If you say you're providing XY services, then the citizens should be able to receive that services, and it should be able to transform, their life health-wise, especially when we talk about maternal and newborn child health. Um, is a complex system of tracking and checking. I'll say complex because you have to start from the basics. What are they even budgeting? So you start from there, participating from when they are developing their medium-term sector plan. Then you start from engaging when these budgets come together, move from plan to actual budget. Then it moves to when this thing is being defended at the State House of Assembly to ensure that all the priority issues affecting women and children did not, find its way out of the budget. And then when it gets passed, you start looking at, so item 1, 2, 3 are our issues because they transform the health and well-being of our women and children. So are they being implemented? What is the quality assurance mechanism that was imputed? What is the what we call supervisory supervisory this thing that the plans that they built into it to ensure that they deliver quality, they deliver on time, and they judiciously use the funding that's been budgeted for the purpose which is meant for. Then we come back, like Esther said, we pat them in the back if they do well. If they didn't do well, it's not per se a struggle to do fault finding just so we can fight. But we can sit together and say, so what did you not do well? What went wrong, probably in the planning or in the execution, that made the impact not felt, and then we just go back to the drawing board and re-strategize. Thank you.
Well, well, thank you very much. Messages can start coming in. In case you don't have the opportunity to drop yours on the comment section, we also take text messages, and it's +234 8054 383460. A lot of our viewers outside the country said they would also like to participate via text message sometimes when their networks can't connect. So it's an all-rounder. We're streaming live both on YouTube and also on Facebook. So any of the means you can get us from, drop your comments, drop your views or your questions for our guests, and they'll be here to answer all of that. I'll come back now to Esther. There's a very important aspect you talked about, social accountability, but I want to even narrow it down now to um, just coming up from the pandemic. COVID-19 really dealt a whole lot of blow to not just countries that were prepared, you know, developed countries like America and the rest, who we know they have some structures on ground, like the UK, France, and all that, but also developing countries and underdeveloped countries. So it was an overwhelming experience because this wasn't what any country or anyone saw coming. So I'm asking, in the place of COVID-19, what is the organization doing to also tackle the issue of maternal health care? Because a lot of women were scared to go to the hospital that period of the pandemic when it was highest. Everyone was scared, even not just for pregnant women, people who had other underlying ailments, like people who had asthma, who are diabetic, and all that. Everyone was scared and all that. So what is options also doing to make sure that women are guided, because like it or not, women are always the worst hit for all of it. So they become caregivers at home, they become nurse Eliza at home, and all that. So what should we be projecting now? And then the budget is also being presented at the National Assembly for onward review and all that. So, what is the organization looking forward to? Also empowering the women folk, and then also maybe finding ways to bring in more states to align and partner with you on.
You have to unmute
Yeah,
yourself.
I think just leave it on. I'll just unmute it from here.
Yeah.
Okay,
All right.
okay.
So, yeah, during the lockdown period, of course, people say when COVID was here, but COVID is
Yeah,
still here. I like to say that we are still in pandemic. We are not out
yeah,
of the woods yet. So, but in the time during the time of the lockdown in Nigeria, of course, as options, we realized that essential services were being threatened, especially across the states where we worked, Lagos, Bauchi, and Niger State. And we sort of took on a quick or rapid political economy analysis to identify the real issues that were on ground. How were women, children feeling these issues? What were the barriers that they were up against, and what were the fears? So we made all of this and documented them, by taking out that rapid political economy analysis, or just also finding out how the health facilities were, whether they were properly situated to even attend to the people who wanted to get to the facilities. So in all of that, we discovered that on the supply side, there were issues of unpreparedness. And then on the demand side, which is the people going to the facilities, there were issues of being afraid to go out because they don't know how, of course, our hospitals were looked at as the center of transmission, for instance,
yeah,
when
yeah.
are not prepared So a lot of people stayed back home with all of these conditions. So we had, looking at that brief sort of rapid assessment we did, we had some of the answers or some of the issues to say, government, this is what you need to do, this is what you need to put in place. And so we started by advocating that the government puts in place PPEs, as we know them today, the personal protective equipment, from like
Equipment, yeah.
hand washing and all of that, in areas where they were supposed to put those things within the facilities. And then also, on the other hand, we reached out to the communities and the beneficiaries, trying to let them know or understand that, COVID is here, but these are the protective measures put in place. This is how you can protect yourself from community transmission. And also, if you come out to the facilities, you need to protect yourself. But then, of course, letting them know that, there are sort of services that are essential, such as delivering at home. You shouldn't be delivering, having your babies at home in case you have all of these, complications. What would you do? So ours has been that we push for them to go to the facilities to be delivered. Now we also found that there were obstacles, and these obstacles also came from, other barriers such as the law enforcement agencies, who were also now not even in tune with what was happening, and then trying to prevent these people from accessing care, and harassing them on the streets. So all of those things we took to the social media as well as the traditional media to pass on information on how, the different identified groups could act so that access to essential services for women and children. So, and thereafter, we have not ceased in continuing in that effort to ensure that, essential services don't fall out of the radar of government. We have consistently been on the social media telling government what to do. Like, for instance, in Lagos State, we were really excited that during that period also the government opened up an access line to women and children, provided for free deliveries, across the state. And then it made a lot of huge coverage because a lot of women were interested and motivated to go to the facilities and deliver there free of charge, and then they were well catered for. And thereafter, we saw that this was good. We commended the government on social media, and we went ahead to begin to demand that, oh, these services were going on perfectly at the secondary health facilities, but we needed it to also be taken to the primary healthcare facilities. And there's that push for it to be replicated, and then PPEs. And the beautiful thing about this was that, doing this advocacy on media, traditional media, that was not only the strategy we were using. There was also this strategy where, that within the social accountability mechanisms that we have, we call out the state-led accountability mechanisms. We have the health officers or health practitioners within that coalition, or you may want to call it mechanism. And in that process, there were parts of those reviews or those rapid assessments that we did, and they took up, like the director for primary healthcare took up some of those information that we were getting, and then were able to make some of those changes in terms of ensuring that, there were PPEs in place, and then the issue of absenteeism was being tackled. Because, of course, the medical personnel were not going to the facilities because the issue of us, they were staying away. And so how were they? So these were also things we made sure that, they were also in place, so that on the demand side, the people will not go to the facilities, women and children will not go there and then don't access healthcare. Now, taking it on to budget planning processes, we've learned a lot of things, coming out of COVID lockdown. And we've seen that the issue around, one clear thing that actually suffered was essential maternal and child health services. Immunization suffered. We suffered a setback on immunization. We suffered a setback on antenatal care and safe deliveries. And so moving forward, that has been the bane of our advocacy. And I'm sure Chinasa will tell you a lot more, that she has been involved in the budget planning processes. Now, that has started in the state. It starts with the annual operational planning, ensuring that some key activities get into the budget planning process, just like she said. And then it will now go to the National Assembly. At the federal level, what we do most often is at the policy level, engaging with other bigger coalitions like the Health Sector Reform Coalition or other partners, and to work with policy influencers at that level. But mainly options E for A program is at the state level. However, we also have big programs like, I think, sorry, we have bigger programs like the LAFIA program that has just been launched just this year, that will be working at the federal level. So again, options is looking at this both at that larger policy level and then at the state level on ground, ensuring that, this is the budget planning process, ensuring that priorities for women are being put in place. For instance, the launch of the RMNCAH so RMNCAH plus E, and nutrition, what that is a mouthful. We are adding
Yeah.
the elderly and all of that. Yeah, okay, was launched yesterday, so we are well aware of that. We sent in delegates, especially from the youth angle, to be representatives, and we're also looking at how best, do we bring the results that we are having from the states, and then linking it up to the national and at the federal level to ensure that there's that synergy of whatever is happening at the federal level that can trickle down to the state level and vice versa. So we are actually working with the budget planners at the state level to ensure that priorities for women are budgeted for. Thank you.
Mm. Okay, thank you very much. I'll come to Chinasa to tell us more about, because when you were even wrapping up, you said something about the COVID-19 issue also affecting a lot of women accessing, um, commodities and even immunization. So I'd like Chinasa to talk about the family planning angle of it all, because that also suffered a huge loss, and a huge setback too. So while a lot of researches and reports have also shown that there will be or still are going on a lot of unwanted pregnancies, not just because couples were more at home, but also because women weren't able to access their family planning commodities. So I will ask Chinasa that when we come back, because these are very pertinent issues. Like you talked about the children angle, where immunization was really a huge one. And just when we were thinking we were coming out of the woods when it comes to issues of child mortality as well, this whole pandemic was bringing us like 2 steps forward, 10 steps backward. But let me take a few messages here, and then I'll come back and talk to Chinasa on the family planning issue. I got this one here from Murphy from Port Harcourt. Hi, Murphy. Thanks for joining us. It says, nice show there, and kudos to your two intelligent ladies. Please let them apply to be ministers of the country. Okay. Okay, that is if they're politically inclined. I mean, the NGO world has a lot of women who could do very well in politics as well. Thank you, Murphy, and thanks for joining us from Port Harcourt. I got this one here, and it's from Philip. It says, good afternoon, time. You just asked your guest the question I wanted to ask them. It is on family planning, because even in Warri during the COVID-19, the military wasn't letting women go out to access anything, and it really hindered the progress for women. Okay, so someone is also collaborating to that talk. So Chinasa, let's even hear you on family planning. And then if you could also chip in a little on malnutrition, because that also affected a lot of children. So children who were also being placed on some form of malnutrition treatment and all that also couldn't. In fact, it destabilized a whole lot of movement, so not just for the health issues, for businesses, for corporate worlds, people were losing their jobs and all that. So let's hear what you have to say.
Yeah, so thank you, Emmanuel. The thing is that like we all saw, everyone is aware of the impact of COVID one way or the other. There's nobody who wouldn't have felt either directly or indirectly the impact of COVID,
Mm.
or is still even feeling, because the
Yeah.
fact that some states are out of the wood doesn't mean that is still not a threat to, other states or other people in other climes. And this is quite felt across sectors. And when we come to healthcare, like we say, women and children are the indicators that show us how well we are doing as an economy. Um, the impact of COVID on family planning cannot be overemphasized. Like here in Niger State, I will tell you that the uptake of family planning dropped. You understand, from
Yeah.
where it should be to 6 CFR. So that shows us that women were not accessing care generally, and it is only
Yeah.
some of them, because of the cultural issues, that are very peculiar to certain environment like here. It's only sometimes when they go for immunization that they are able to access family planning services.
True.
And when those things were not happening, they were also there was like a consistent decline to their access to family planning, even if it's just for counseling. Um, but what we try to do during that period is, just like she said, there was some impediment around, our security outfits not allowing people to walk around. So we had a dialogue with the states to ensure that, despite the lockdown and the restriction of movement, people who have, especially women and children who require to have access to medical care, need to have access, you understand, to use
Yeah.
the road to go to the nearest facilities that they've been accessing. And by doing so, the government had to issue an instruction for law enforcement agents to allow women who have their hospital cards, men who are accompanying either their women or their children to the hospital for different cares, emergency issues like delivery and other thing ANC to happen. So with this, we had a free passage, and it started showing, like a green light to the access. But notwithstanding, across board, we can still see that the uptake is slow. And even now that the state is coming out from COVID, because many of us have not shaken out from there. And then the issue of resources, some funds, health programmatic funds were, moved to emergency response, and it's affected supply of commodities. In fact, here I will tell you emphatically that they are running consistent shortage of commodities and essential life-saving commodities. Why? Because funds have been mopped up for the emergency response, and even now that we are still moving into post-COVID phase where everyone is thinking about how to keep the infection rate at a low rate, and it
Mm.
hasn't even come to the priority of the state to say that this thing has to work in parallel. So having this understanding as a coalition, what we've tried to do is bring those issues as top priority for advocacy engagement, starting from the committee engagement to policy engagement with policymakers and decision makers to program officers. We are sounding it quite clearly that maternal and newborn health issues, especially ANC visit, family planning uptake, immunization, and nutrition, becomes a priority as we, move to the post-COVID phase,
Post
because
COVID.
those
Yeah.
are issues that the COVID has, brought out very clearly. Before, it seemed
Mm.
like something we use a cloth, to cover and manage it inside, like managing it internally. Trying to negotiate how these things will be managed, ensuring that the supply chain to the last mile, you understand, is effective and all that. But with COVID, it brought everything to bear. So on one hand, it affected the service delivery, but on the other hand, he also brought all the issues up in the table for everyone to see, and then for government to really look at how much do we have, who are the partners supporting us, and how do we, respond to these magnitude issues that we have in our hands that are competing priorities that requires immediate attention. So that is the point that we are right now. And for
Thank you.
2021 budget, we want to ensure that those things are itemized and there is a clear-cut budget line for those priority issues so that we make sure that they are implemented.
Okay, thank you very much.
Thank
In
you.
case you just joined us, we're looking at health financing, we're looking at accountability, and I have two wonderful guests here, just doing a whole lot for us here and talking about issues here. This is a Tuesday's edition of Shagalinku, and I have with me as guests Esther Agbon, the Senior Health and Financing Advisor, and also Deputy Country Lead Options E4A Abuja. And then I have Chinasa Imo, the Niger State Advisor, option E for A in Minna. And we're looking at what we can do and how social accountability can help us in terms of health, improve health issues, and make sure that things go well. I'll be speaking with Esther shortly, just to find out more from her. But this is also to say that you have a few more minutes to send your comments or your opinions and your views, and then we'll be reading them here. This one is from Gray. It says, hello. Gray, thank you very much. If you have a question for our guest, please do drop it here, and we'll read them as we go on. We'll be wrapping up shortly, but then let me also bring Esther back to talk with us more on why do you think it's very important for health financing? Because a lot of times, even when you look at the health budget at times, it shows sometimes that we're really not prioritizing health issues, you know. And so the other day we were talking with guests who are from a sickle cell foundation, and they say there's a whole lot of gap in that angle. And then every time you talk about other issues for people who have cancer, for people who have other ailments, you find that there is a whole lot of gap in all that. So, Esther, why do you think the government needs to pay more attention in health financing?
Government needs to pay more attention to that, because health is wealth. Health, I mean, if the citizens are not healthy, then how can the country be productive? That is one. Of course, you can't have a country full of people who cannot, who at the productive age cannot even, they are not healthy enough to work. So that being said, but then the government has to also be interested in ensuring that people have access. And I mean, being able to have access good health, I mean, requires that, people are having, unhindered access to their health care. And having unhindered access to your health care implies that there has to be quality of care, the healthcare has to be affordable, and it has to be equitable. Okay, so I mean, there has to be fairness across how people access this health. So health should not be just for the rich who have enough money to pay for it, and then the poor are left out because they cannot afford to pay for their health. And so that is why many other strategies of health financing come on board. Like you can hear about the community insurance scheme or private health insurance schemes or other insurance, public, insurance schemes that they put on board, just for the aim of pulling resources together to ensure that, one can access health at any time of the day. Now, you talked a little about, conditions such as the NCDs, the non-communicable diseases that are conditions such as cancer, diabetes, and all of that. When such individuals go into some of these life-threatening uh, diseases or diseases that are long-term chronic illnesses that you have to manage, oftentimes they don't even have enough resources to take them all through. So, but with a health financing program or strategy in place that the government puts in place, it may be able to cater for all of this to ensure that people have access by just paying a little bit of premiums for those, excuse me, for those who can pay. And then for those who are really poor than other schemes and programs can be set up, such as the Basic Shelter Provision Fund that has been set up right now, which is sort of like a basket fund that can absorb other funds that will come in and focus on delivering primary healthcare, and also ensuring that at that primary healthcare level, citizens are able to access, healthcare in terms of, quality of care, like I said earlier, the equity, and then it's affordable. So you can go without really like paying money, but you can access care, having put aside some of this money. So health financing is the bane of the health sector. It's one of the pillars, but it is what will help other pillars to be sustained and ensure that health, the clog in the wheel is removed and health is grinding and getting towards the ultimate objective of ensuring that people can access this care whenever and however they need it and with good quality. So government should necessarily pay attention to that. But you find out that right now we have gaps in health financing in the country. We have a health financing strategy at the federal level, but I can't count the number of states that have health financing strategy. So the issue is not just about putting money aside in the budget for healthcare, but having a long-term plan of how you want to cater for the health of your citizens. How you even want to cater for epidemics that come up like this. What are those stopgap measures? What are those issues that that you draw from when you have epidemics? Take out epidemics. In normal healthcare, most citizens have fallen off the radar in terms of accessing this healthcare. And so government needs to put this in place. But then again, the way it's going are the issues that accountability mechanisms take up. Because you set up a basic healthcare provision fund, for instance, and then you say that you want it to reach, then the money is not enough. How do we now get enough resources to come into that basket to ensure that the people at the level that need this care are able to access it? And then for those who are in um, the quintile that are able to pay for healthcare, how are you now harnessing and pulling these resources together to ensure that it goes around the people that need it and then they are able to get quality of care? Because I can't be a paying someone who is paying premium
Yeah.
yearly, and then you go to the facilities and you don't find quality doctors, you don't find quality medicines that are available, and they tell you, oh no, this is not paid for, or this medication is you cannot get this brand. Go outside and buy it. So it now gives people um, sort of distrust about the system. So government needs to build some trust in that system, ensuring that it works, ensuring that it has a long-term plan in place to finance our needs. And now I'll tell you how E4A is coming into this, evidence for action is coming into this, is ensuring that we are planning around systems like the maternal and perinatal death review, which we do across all our facilities. When issues and come out about how mothers and babies are dying, what are the causes? We ask the question, does it have financial implications? What were the real issues? Sometimes you find out that it has financial implications. We want to pick up those financial issues and insert it into the budget planning process so that it's budgeted for. Now, also, they may also, those issues that are causing women and children to die, may not necessarily be a financial issue that may be like a big machine or a big equipment that is needed to report. But it could just be as simple as the store was not open for oxytocin to come out when the woman was being delivered of the baby. So again, that looks at some logistic issues that can be handled at that level. So we set up a plan on how to ensure that staff are available all round to attend and ensure that they keep out the drugs when they are supposed to keep it out, and then those who need it are able to access it at the point of need. So these are the ways we are looking at health financing in E4A. And then we have also put systems in place to track the basic health provision at the primary healthcare level. So once the government has started issuing out these funds down to the facility level, we want to see how many people are covered and how many people are accessing it. By the time we have such information and give back to the government, we know those who are not being reached at all. And then the government can put in place plans to reach those people. That is how social accountability is working around that. Thank you.
Thank you very much. Okay, we're wrapping up soon, but I have one more question for Chinasa before we even wrap up, and then you guys will say your final words. Um, Chinasa, when Esther was talking about the whole essence why health financing is very important, she mentioned how they have to also it's worrisome when people pay premium services and then they get to the facility and they can't access some of the drugs. The hospitals might say the drugs are out of stock or that particular brand is not there. They have to go out. So it's like a double punishment, especially for workers who every month they have a certain amount that is removed, especially for maybe federal or government workers. They have a specific amount that is even removed every month, whether you are sick or not, whether you visit facilities or not. I want to ask this before we wrap up. What can we begin to do differently in training and retraining medical personnel? Because to me, that's where the whole hub is now. A lot of women don't also like delivering in hospitals because they feel or they've experienced sometimes how nurses and even some doctors have treated them badly. We've heard instances where pregnant women will say some nurses will tell them, Madam, push jaw. When you dey enjoy the thing with Oga, we know they there. So these things also make them they don't want to come and assess. So even when the government even tries their best to put these things in place, when they remember past experience from other women or even for themselves, they're like, I'd rather give birth at home with traditional birth attendants and all that. So what do we begin to do to train and retrain medical personnel for optimum services?
Thank you, Mr. Ambassador Emmanuel. Sometimes we look at training of medical health personnel and we overbloat it. And most times the issue might not really be training. It might not be training as per retraining them, but it could be an issue of monitoring. For instance, a nurse or a physician who is working in the facility by qualification is being trained to do his or her job.
Yeah.
But because of attitude, that most people have, especially here in Nigeria, they tend to do a lot of malpractice issues. Um, so we are tracking especially in the BSCPF implementation, to drive transparency and accountability. So it's two ways. The CSOs through the World Health Development Organization, yeah, organization is tracking the services that are being provided. So they are part of the system. They've been inbuilt into the system, but one of their TOR is to track what and how the healthcare providers are providing these services to citizens. So that's on one hand. Then on the second part, we have what we call exit survey. So when you come to the hospital to receive service, when you are going out, after the services has been given to you, you have the ability to fill a form. It's an exit form. And it builds into the performance of that facility. And that forms, their reviews to receive another funding. So it's a way that the JCPF is, the fund release is being. So if this organization, if this primary healthcare is not providing quality services, then there is a question mark. And that question mark raises an issue as to why, when funds have been given to you, your facility have been upgraded to provide at least minimum service package that covers routine services, routine basic primary healthcare services. So why are you not performing at optimal? Why are your beneficiaries having issue with the services you are providing? And this thing has been built in place, and we, as an accountability mechanism, are tracking that through the WHDC and through the primary healthcare, through the contributory health scheme, because all these, in fact, through the gateways in general, we want to track this to ensure that at the end of the day, the three gateways will come with a harmonized report, because if there is discrepancies, then there is something that is happening somewhere that someone is not talking about. And truth be told, such mechanism would, being put in place would help curtail some of these things like absenteeism of health workers from their post. Because if I come to receive the services and you have required skilled personnel there, and then I didn't receive that services because someone who is supposed to be there is not there, I have the right to report. I report you to the WHDC, and I'll fill the exit survey form, and then the claims will not be made. So you see the way it's all linked. For every services that you provided, the claims will be verified by the contributory health scheme, and then the facilities reimbursed. So all these things, when you put them together, you see that it is geared towards improvement of services. And then when you talk about capacity strengthening, some healthcare workers have generic skills, like you say, I'm a nurse. Nurse for what? So that comes the question. There are organizations, not us, that are working to build the capacities of such healthcare workers with this tax shifting, tax sharing policy. So some certain cadre of these health workers are being trained to handle certain services. And those, because they've been trained to do that, they are continually receiving mentoring, trainings, mentoring services that will help them do their work well. And then you also know where that's your work, the limits of where your professionalism lies. When it goes beyond that, you apply the next line of action. If it's for you to refer to the secondary health facilities, you do that immediately. So those systems are inbuilt into the basic care provision fund, which is self-financing. And we look at that in totality, it will improve, the lower cadre of services, which are where we have both communicable and non-communicable diseases and issues affecting women and children. So yeah, so that is like what
Okay.
those granular issues, we are trying to ensure that they come in full practice. If the strategy is there, but how far do you implement it is where we are interested in. Thank you.
Okay. Thank you very much. Okay. So we're wrapping up now. Esther, I would like you to say your final words. What we all need to do as citizens, as a people, as government, whatever that comes to your mind. Your final words.
Yeah, so as a people, we need to keep asking questions. We need to keep saying, when you receive a good service, yes, you have received it. When you've not received a good service, you have not received it. But then, of course, individual voices is difficult to be heard. So we need to
Yeah.
come up to at committee levels, engage in committee level organizations. We also at state level, coalitions that exist. Let us come together and make our voices heard. You see what is happening today on the streets of Lagos and other commercial cities around NSAS is the voice of the people. I'm not saying that we should go violent, but we must always demand from government what the responsibilities they have. They should be able to implement it, you know, um, to get to the people. Now, also on the side of the government, I would advise that they look into the issue of health financing, because if they do that, that is how we can plan, a long-term plan for how to finance our health. And it's not just about maternal and child health, but the whole system itself, infrastructure, services, the personnel, etc. They need to be planned for. So we don't have to have strikes within the facility. We don't have to have equipments that personnel cannot use. So in terms of planning, if you have that, the capacity you have and how and you plan for more capacity that will able to, man your facilities and then deliver quality services. Across board, we have very poor infrastructure. Those also need to be catered for. So health financing, proper planning, proper strategy on health financing in the health sector would help us address this. Thank you.
Thank you very much. And Chinasa, your last word. Mic is mute.
Just like Esther said, just like Esther said, as citizens, we need to start being aware of what is happening with government, what is happening in our environment. We need to start asking questions and just the right question. And not just asking for the purpose, like I said before, to fight government. Sometimes we have this notion that government know it all. They have they should be able to have the policies right. They should be able to know the right thing to do. No, as a singular person, they have their different specialization, and then they come in and become government. It is only when we participate in coalitions such as what Ifoye is helping to build across states in Nigeria that we start looking at the real issues, single them out, and then start asking questions. Then, if it is capacity issue, we start now building capacities of those. Well, I'll give you an instance. When we came into Niger State, the whole question was about not funds not being released. Government is not releasing money for health, and then we started asking the right question. Yes, we've heard government is not releasing funding for health, but what's the issue? By the time we get down to the granular issues, it started from just writing the right memo, submitting those memos on time, even having a creation of budget line for those issues so you know what to target your request to. And you see that those issues, and they are just not what the governor would know ordinarily to do. And if you don't ask this question, if you don't come from ground up, the government will not fund you. Because in as much as they've given you money, what we call the envelope system, I don't know why they call it envelope system, even though they've given you money, you still need to build a budget line that you use to draw down such funding. So it's issues like this. When you identify the real problem, you start solving it from that level. By the time it gets to the upper level, then we talk about the fact that funds are not being released. So we need to participate more. We need to ask questions. We need to track projects across us. You understand? To
Mm.
ensure that those people are aware, that we are also aware that these things need to be done at a certain time and we need them to be done. Thank you.
Thank you very much, Chinasa. It's been a pleasure having all of you. Some messages are coming in now. I'll just quickly read them as I wrap up now. This is from Tina Owen in Kano. It says, more grace. Tina Owen is also greeting our guests here. Thank you very much. I had two more messages here. I would have loved to read so many messages coming in, but I just decided that we needed to let our guests talk extensively because when it comes to health issues, we really need to talk about it. Okay, I got this one here from Barrister Lima. He says, good afternoon time to your guest. Nice topic you have there. I like the fact that they focused also on maternal health because the COVID-19 pandemic also dealt with it a lot. Yeah, we talked about that and I asked my guests on their views and what the organization's been doing. Okay, people, time to go. I wish I could still stay and talk more with my guests, but I promise we'll still find time to do a part two because there are so many other issues I really would have loved to ask them. Issues of citizenship participation, which Esther even brought about the NSAS analysis, because I was also going to ask them that I really like the fact that everyone came out in a loud voice. Young people, everyone just came out with a loud voice to say enough was enough. And I think the government listened as well and all that. So we'll come back by God's grace and find time to bring them back here to talk with us. Okay, finally, I want to thank everyone who's joined us all across the world. We always get feedbacks. And yes, the videos are here for countries whose time zone is different from ours. We usually even get more views from the videos after the streaming because of countries whose time zones are different. So the videos are here. Keep your comments coming. Our guests will also be looking into the comment sections and they'll be responding to them. And hopefully, when we bring them some other time for the part two, we'll be able to collate some of this response and then ask them to reply. Thank you all for joining us. And yes, remember to join us, like our Facebook page, our YouTube page as well. Even on across all our social media handle, it is at Shagalinku TV. Let me thank our guest once again, Esther Agbon, the Senior Health Financial Financing Advisor and Deputy Country Lead for E4A Abuja, and also Chinasa Yu Imo. She's a regular here. She's the Niger State Advisor for Minna, and we were looking at health financing and accountability. You know what we need to do as citizens to also make sure that we follow the money. My name is Ambassador Emmanuel Gabari, and this is urging you all to stay blessed and have a beautiful Tuesday. Remember to also join us on Saturday, 2 p.m. West African time, when we'll be here to do the Saturday's edition of the show. From all of us here on Shagalinku and the team, we want to thank you for joining us. Let's do it again on Saturday, God willing. Bye bye and have a great day.
Bye.